everyone, I'm Caprice.
And I'm Novisi.
And today we are going to describe, demonstrate, and provide limitations for adult and pediatric positioning and postural strategies in managing dysphagia.
What is dysphagia? Dysphagia can be defined as difficulty swallowing.
And treatment strategies are provided to reduce aspiration.
Postural techniques should always be introduced first as a treatment strategy because they are quick and can have big impacts on the safety and efficiency of the swallow. These strategies do not induce fatigue and are not complex.
According to Logman 1995, adult positioning strategies include several head positioning maneuvers such as chin tuck, chin up, head tilt to the strong side, head rotation to the damaged side, and head rotation and chin down combined. Adult positioning strategies also include postural strategies such as lying down on one side.
According to Arvidson 1998, pediatric positioning strategies include reclining position and central alignment.
Chin tuck can be used for persons with a delay in triggering the pharyngeal swallow or who may have reduced posterior motion of the tongue base. This narrows the airway entrance and also pushes the tongue base backwards towards the pharyngeal wall.
This is chin tuck. The idea is for you to tuck your chin while you swallow. Go. Good. Chin up can be very beneficial for people with motor neuron disease or oral cancer. It can be used with persons with inefficient oral transit because gravity helps the bolus clear the oral cavity. Chin up. The concept is for you to raise your chin up while you swallow. Go. Good.
Head tilt to the stronger side is used when someone has unilateral or pharyngeal weakness on the same side. Gravity helps direct the bolus down the stronger side.
Head tilt to the stronger side. In this case, your right side is your stronger side. So tilt your head to your right side while you swallow. Head rotation or turn to the damaged side. This can be used for 3 groups of people. First, it can be used for persons with unilateral laryngeal dysfunction because it increases adduction. Second, it can be used for persons with unilateral pharyngeal paresis because it eliminates the damaged side of the pharynx from the bolus pad. And number 3, it can be used for persons with reduced laryngeal closure because it puts the glottis in a more protective position. Head rotation to the damaged side. In this case, your left side is the damaged side. So, rotate your head to your damaged side and then swallow.
Head rotation and chin down combined. More than one strategy can be combined. This creates for optimum airway closure.
Head rotation and chin down combined. You're going to rotate your head to the damaged side with your chin tuck and then swallow. Great.
The previous strategies we discussed were adult head positioning strategies. The following is a postural strategy. lying down on one side. Patients with reduced bilateral pharyngeal contraction can benefit from this. It eliminates the gravitational effect on pharyngeal residue.
Lying down on one side. This idea is for you to lie down on your stronger side and then swallow. Good.
Ow, my back!
Oh my goodness, you okay?
Yes, I think I'll be fine. My bones don't work like they used to.
Oh no. Okay, one thing you will want to remember is to make sure that the client is physically able before doing this.
There are a couple of precautions to be considered. Physical and anatomical characteristics should be identified. As such, choose treatment strategies that are within the client's physical capabilities. Secondly, those who are not able to follow instructions may have difficulties with these tasks.
Now we're going to talk about pediatric positioning strategies. One, this includes reclining position. This can be done using a bobby pillow or a reclined infant seat with trunk and head support to provide the child with necessary support to have balance, stability, and mobility capabilities, but not to restrict potential movement. Reclining position. The idea is to recline a child with either a car seat or a bobby pillow. This is going to support the trunk of the child and the child's head before they swallow. Good.
Central alignment consists of neutral head flexion, neck elongation, shoulder girdle stable and depressed, trunk elongation, pelvis symmetrical in neutral position, hips at 90 degrees, feet in neutral position with slight dorsiflexion and never plantar flexed. This can assist the child in attaining a base for central stability. It allows for a more oral motor, oropharyngeal, respiratory, and sensory motor functioning.
Central alignment. Before we make the child swallow, we're going to make sure this child is in the right position before they swallow. Honey, can you please sit up? Elongate your trunk. Keep your neck elongated. Relax your shoulder girdle, depressed. Make sure your leg is in a neutral position. Now you're ready to swallow. Good. These are a few precautions to consider. Not all seating and positioning strategies work for all children in all situations because a child's mobility varies throughout the day and over time. Young infants should not be positioned with the neck flexed because they will not be able to breathe, which can ultimately lead to death. The structures that support the pharynx can collapse when the neck is in this position. Children with cerebral palsy often have a low tone base or hypotonia, which is often accompanied by decreased strength. Unless there is improvement, it is likely that there will not be progress with these strategies because it will likely cause frustration within the patient, the caregiver, and the SLP.